Major crises like wars and natural disaster affect the lives of millions of people around the world. For some affected people, the mental health and psychosocial consequences can be both serious and long-lasting. 5 key factors have been identified that can reduce the risks of negative mental health outcomes for people after a crisis experience. In 2011, the World Health Organization published a manual on psychological first aid, a frontline intervention that promotes these 5 protective factors. PFA is now a key recommended first-line response in the immediate aftermath of a crisis. The WHO model of PFA was developed with low- and middle-income countries in mind. It is a series of practical, humane, culturally adaptable actions that any layperson can do to support people who are distressed or vulnerable after a crisis. PFA can be provided by anyone, neighbors, co-workers, or any person at a crisis site. It does not depend on the arrival of mental health professionals or emergency services. But even though PFA requires only brief orientation, delivering this on a massive scale using conventional face-to-face training is costly and slow. Therefore, only a tiny fraction of the large populations routinely affected in a major crisis will ever have the chance of receiving PFA if they were in need of support. Our team developed the PFA model for WHO and since 2011 has been adapting the content for different cultures and crisis contexts. Despite the incredible promise of PFA as an intervention that can be delivered by any member of the public, the limitations of current training approaches deny this potential. Our proposed project aims to overcome this by cooperating with governments and private sector communications companies to deliver digital PFA training directly and rapidly to entire populations affected by crises. If massively scalable PFA training can be deployed effectively so that the general public can be mobilized to support their fellow citizens in distress, it will radically change the face of frontline mental health responses in crisis settings.